Have you ever gotten scared when you see someone choking and you do not know what to do? I have been CPR and first aid certified for almost 3 years. Everyone should be encouraged to take a CPR/first aid class because it is a great class to learn many ways to help others, including saving a life. I would like to inform my audience about the steps and benefits of CPR/first aid, in this case, choking. In order to understand CPR/first aid, we will go over what is CPR/first aid, the proper equipment needed, and the proper steps to follow. First, we will learn about what is CPR and what is first aid. CPR is short for cardiopulmonary resuscitation, and first aid is help given to a sick or injured person until full medication treatment is available. Now that we understand what CPR/first aid is, we will discuss the proper equipment needed. You need to know and have the proper equipment for CPR/first aid. For first aid, we have our first aid kit, which includes bandages, cold packs, anything necessary for any type of burn, cut, any small injury. And for our CPR, we have our chest pads that also come with an AED, and you put on each side of your chest, one on the top side and one on the bottom top of your chest, and you just pretty much connect it to the AED, and it tells you step by step what you have to do. After looking at the proper equipment needed, we can finally talk about the proper steps for completing CPR/first aid. Knowing the proper rules and steps for doing CPR/first aid will help you save a life. The Baby Center Medical Advisory Program mentioned on January 2014 mentioned that children test their physical limits and get caught in all kinds of dangerous situations. Also, the Associated Press on January 19, 2005 mentions that two common problems are rescuers are not pushing hard enough or frequently enough on the chest to restart the heart. So redcross.org has all the steps and procedures to follow when doing CPR/first aid. So this is our CPR steps for when the person is not breathing. So after checking the scene in the injured or ill person, give 30 chest compressions. Push hard, push fast in the middle of the chest, at least 2 inches deep, and at least 100 compressions per minute. Give 2 rescue breaths. Tilt the head back and lift the chin up. Pinch the nose shut, then make a complete seal over the person's mouth. Do not stop. Continue cycle of CPR. Do not stop CPR except in one of these situations. If you find an obvious sign of life, such as breathing, an AED is ready to use, another trained responder or emergency person will take over if you are too exhausted to continue or if the scene becomes unsafe. Now, CPR for a child and an infant. You give 30 chest compressions. For a child, you push about 2 inches deep. For an infant, push about 1.5 inches deep. Push fast, at least 100 compressions per minute. Step number 2, give 2 rescue breaths. Tilt the head back and lift the chin up. For a child, pinch the nose shut, then make a complete seal over child's mouth. For an infant, make complete seal over infant's mouth and nose. Blow in for about 1 second to make the chest clearly rise. Do not stop. Continue cycles of CPR. Do not stop CPR except if you find an obvious sign of life, such as breathing, an AED is ready to use. Another trained responder or emergency person will take over if you're too exhausted to continue or if the scene becomes unsafe. Conscious choking. Cannot cough, speak, or breathe for an adult. You give 5 back blows. Bend the person forward at the waist and give 5 back blows between the shoulder blades with the heel of one hand. Give 5 abdominal thrusts. Place a fist with the thumb side against the middle of the person's abdomen, just above the navel. Cover your fist with your other hand. Give 5 quick upward abdominal thrusts. Continue care. Continue sets of 5 back blows and 5 abdominal thrusts until the object is forced out. Person can cough forcefully or breathe, or person becomes unconscious. Unconscious choking. Chest does not rise with rescue breaths. Give rescue breaths. Retilt the head and give another rescue breath. Give 30 chest compressions, basically starting CPR all over again. When an infant is choking and he's conscious, he cannot cough, cry, or breathe. Give 5 back blows, which you give firm back blows with the heel of one hand between the infant's shoulder blades. Give 5 chest thrusts. Place 2 or 3 fingers in the center of the infant's chest, just below the nipple line, and compress the breastbone about 1.5 inches. Step number 3, continue care. Continue sets of 5 back blows and 5 chest thrusts until the object is forced out. The infant can cough forcefully, cry, or breathe, and the infant becomes unconscious. Unconscious choking for child and infant. Chest does not rise with rescue breaths. Step number 1. You give rescue breaths, retilt the head and give another rescue breath. Give chest compressions, which is basically starting CPR all over again. Today I have informed you about the steps and benefits of CPR/first aid. We have discussed what is CPR/first aid, the proper equipment, and the proper steps to follow when doing CPR/first aid. I'm glad to be a part of the CPR first aid and be able to save many lives. Thank you.